Hey, it's Janae, and welcome to Daily Dental Hygiene. Today's topic is fluoride varnish. Lots of our patients don't want fluoride because obviously they're gonna get fluoride varnish and then die immediately. Duh, isn't that what happens? Okay, so today we're gonna talk about, number one, what is fluoride varnish, how to apply it to the teeth, and what are the post-op instructions. So if you don't know this, which if you're watching this, you are in dental hygiene school or you were in dental hygiene school, you should know that teeth form at about 5 to 7 weeks in utero. So when you're born, you're gonna have all the enamel pretty much that you're ever gonna have. And we have to use things like fluoride to keep your teeth from literally getting cavities and falling out because your body's not constantly rebuilding brand new enamel every single day when you go to bed. That would be a miracle, but not the case. So we have little tools like fluoride varnish. What it does is it comes with the little paste and a toothbrush like paintbrush applicator, and you coat the teeth with it. What's great about it is it doesn't matter if you don't get every single nook and cranny and every spot of the tooth. When your saliva gets that fluoride varnish in it, it will then naturally coat all the teeth. So don't worry if you didn't get as much as you wanted on a certain area. It's covered. When I go to do someone's fluoride varnish, I put it first on areas that I know are high risk, areas with recession. We know fluoride varnish is incredible for cavities, but it was actually originally approved by the FDA for sensitivity. That is its number one best use, is actually sensitivity. So if your patient has recession or they've got crowns or they have just, areas that are compromised, put that as the first priority. Another thing I want to go over is post-op instructions. I see people all the time coating patients' mouths in fluoride varnish, and then they're like, okay, you're good and ready to go, bye. And then they let them go. And what was the whole point of doing this if you didn't tell them how to properly keep it on their teeth so that they have the best uptake? So number one, nothing hot. No hot soup, no hot coffee, no hot tea. That will melt it off the teeth. Number two, nothing super crunchy like tortilla chips or really, really abrasive food. That will scrape it off the teeth. And number three, keep it on as long as you can. I know that's tricky, but I tell patients that the longer you keep it on your teeth, the more uptake it will have, the better it will bind to your enamel, the more you will get out of it. So keep it on your teeth as long as you can. If you have a dental cleaning in the morning, don't brush it off until the very end of the day or right before you go to bed, so it had like 12 hours to get into your teeth. But I see patients literally put this on, hate it, and then they scrub it off their teeth an hour later. And it's like, why did you do that? It's like going and running a marathon and then eating an entire chocolate cake. I mean, you just counteracted exactly what you needed to do. So keep those 3 post-op instructions, and that will help you keep it on the longest possible. Patients always complain that it's sticky on their lips, and that's super annoying when you're trying to talk or just in general. So tell them they can use a little bit of Vaseline, a little bit of Aquaphor, regular chapstick. Really, really, really good to prevent the lips from getting sticky. You can even put that on your patient's lips before you even do the fluoride varnish so that they don't even have to get to that point to experience the grossness. Another good tip is patients don't like the look of fluoride varnish. It's kind of chunky and kind of gross. So I try not to coat the very fronts of their teeth very heavy, because if they're looking in the mirror and they're on Zoom or they're whatever going out to lunch with their friends, they're going to be super upset and they're just going to scrub it off their teeth because it's obviously uncomfortable and they can see it. So try to be strategic about it. Try to coat the backs maybe a little bit better so that they will, fingers crossed, keep it on a little longer. But those are all my tips and tricks for fluoride varnish. Just be sure not to eat or drink for 30 minutes after you use it. And the rest are the post-op instructions.